So I'm showing you the video environment for the project with the topic multi-user virtual reality environment for respiratory therapy for COVID-19 patients in Unity 3D. So what I'll do is it's a multi-user program, but I'm showing you the environment so that we get a scope of the project. So this is a hospital environment. The environment covers the a block of hospital buildings with the roads. So there is a main hospital compound and other hospital blocks. So there is a model of a car park. There's a model of car park and other hospital centers blocks. But what I'll be concentrating on will be activities that will be going on in the rehabilitation center. So that's the COVID-19 rehabilitation center, where there are various activities will be done. So in the center, the patient is have the temperature checks. After that, then the various other activities that are done in the environment is done. Okay, so this is the user environment. I have in this setup we have a COVID-19 patient that is being modeled, and the patient first gets the temperature checks, and after checking the temperature, the patient is assessed by the nurse to determine the patient's current situation. And so we have I have a desk, 2 desks with the nurses that does their assessment of the patient. And once that is completed, the patient is made to watch a video and is going to be observed by a doctor. So the patient, I can start the video, and the video is a respiratory therapy video that seeks to train the patient regarding some of the respiratory exercises and the functions of the respiratory organs. So a video is played, and video can be paused at any point in time whilst the patient is observing it, and whilst the patient is watching, and the doctor is also observing the patient as he's watching. Then also the video is controlled. You have the start and the stop video. So at any point in time, the video is stopped and started, and after the patient has watched the video for a while, the patient is asked to do some of their body exercises, rehearsal, to ensure that the patient knows the kind of exercises that they're supposed to do. So for the body exercises, the patient is made to move around in forward, and is made to move backwards, right, and then left. And as that is done, you can see on the other screen as well, because it's a multi-user. So if I do, patient is made to do a forward, is made to do a forward move, and it shows on the other screen. Can also be made to do a backward move, as well as a right move, and then a left move. And once that is done, the patient can now is now asked to do a full. Once the patient has gone through the process, the patient is made to do a full body exercise, and it's will be observed by their doctor. And if the patient happens to have any condition after the exercise, after a doctor observes the patient whilst the body exercise is being made, after which if there are any conditions that the patient that occurs to the patient after the body exercise, there is a room, observatory room, that the patient is made to stay for a while it's being observed, to ensure that the patient is in the right condition before the patient is asked to leave their premises. So this is how my project works. Thank you.